Healthy Built Environment for Health Professionals training series. Today we are excited to be introducing Heather Deegan from Interior Health. Heather will be giving a presentation titled Healthy Food Systems from Inside the Health World. All right, I'll pass the mic off to you, Heather.
Great, thank you. So thanks for this amazing opportunity to share the information that forms and shapes our programs here in Interior Health. And I am a registered dietitian, and I'm responsible for overseeing our tobacco reduction program, tobacco enforcement program, as well as our healthy eating and food security programs. And today I have the great privilege of talking to you about some of the provincial context and some of the work that's happening within the Health Authority and then beyond into communities throughout the Interior Health catchment area. So the Food, Health and Wellbeing in British Columbia was a very important document that was released in 2005 from the Provincial Health Officer, and it was the annual report focused on food issues and specifically food security. And in this document, it indicated without a doubt that in BC, food is unaffordable and inaccessible for certain groups. And that's a result of declining farmland, reliance on imported food, and the inability for certain populations, for example, low income, to access safe, nutritious, and sufficient food. And these all contribute to food security in the province of BC. And also that individuals, communities, and governments all have a role to play to support food security initiatives to ensure that we have access to healthy food for everyone in BC. And then we have some recent evidence from colleagues in Ontario that people from food insecure households are more likely to have heart disease, diabetes, and high blood pressure. And that's a research paper that was published in 2003. And we know that children are at particular risk for poor health in food insecure households. And then most recently in a research publication from 2015, just last year, indicated again clearly that adults from food insecure households have higher utilization of health care and place a higher burden on our healthcare system. So these are some strong indications that food security is an issue of importance for health and that we all play a role in helping to improve and increase food security on a community level. This slide talks about the BC context. So these are some important quotes that were made by Dr. Daly, Medical Health Officer at Vancouver Coastal Health, and indicating that while the healthcare system is designed to treat people once they are sick, we all need to work collaboratively to address those factors that keep us well and prevent us from getting sick. And in addition, no one sector, agency, or public can tackle these issues alone, but we must act collectively to ensure that all levels of public policy support healthy lives. And again, these are really important statements on behalf of public health and the role that we play through engagement with really critical community partners on a provincial scale, on a regional scale, on a community level scale to address issues of importance to creating environments that are conducive to people being healthy. In 2011, the province launched Healthy Families BC as part of the Ministry of Health Innovation and Change agenda. And this is a really important initiative that's focused on health promotion, prevention, and self-management to improve the health and wellness of British Columbians. And essentially working to create healthy communities where people live, work, learn, and play. So within this broad initiative, there are different pillars of work, one being healthy eating, one being healthy start, one being communities for healthy citizens, and one being healthy lifestyles. And there's also another pillar of work focused on healthy schools. And the two that are circled in red are of most pertinence to the work that I'm going to talk about today. And in terms of the healthy eating strategy goal, we are looking at a provincial healthy eating strategy that indicates how we can function collectively within health, pulling members of health authorities together to improve healthy eating in British Columbia. And this slide, this photo is a warning of the shape of things to come. We currently have a high and ever-increasing prevalence of obesity. In 2010, the stats indicated that 59% of Canadian adults were overweight or obese. And in fact, this prevalence of obesity is a perfectly natural response to what we call an obesogenic environment. An obesogenic environment is an environment or a societal context that promotes inactivity and sedentary lifestyles, and that is enabled through suburban design, a car culture, a computer-based work culture, screen time, TV, gaming in youth and children, etc. And another factor that contributes to an obesogenic environment is high availability of inexpensive food of low nutritive values that is easy to access. So we have, for example, an urban environment, what we call food deserts, where in an inner city or an inner urban environment, a low variety and low healthy foods that are available at affordable prices. So we're likely to see gas stations, convenience stores, and liquor stores in those food deserts that sell highly processed, high sugar, high salt, high fat foods, and again, foods that are not high in nutritive value. And in the BC context, if we think about our remote and rural communities, and that's a particular concern to us here in Interior Health, we have many remote and rural communities. If, in fact, healthy food choices are available in those communities, they are often unaffordable and out of reach for many people who live there. So another important provincial policy document or mandate document is BC's Guiding Framework for Public Health, and this was released in 2013, and essentially this document sets a strategic context for public health by creating a long-term vision for a sustainable public health system into the future. And the document has 7 broad goals, and the one of particular interest to this work is Goal 1, which is healthy living and healthy communities. And it indicates that we need to create supportive communities that make it easier for people to make healthy choices at every stage of life. And there's a bit more description there, not to get into those details, but there are 3 objectives that support this broad goal: improving health of children through enhanced health education partnerships, school-based healthy living programs that encompass healthy eating, physical activity, and tobacco-free living. The second objective is to work with local governments to create health-promoting environments and community-based programs that encourage British Columbians to make healthy choices. And the third objective to support this goal is to enhance workplace wellness by supporting employers to implement policies and programs that protect the health of their workers and encourage positive health practices. And then further, within the guiding framework, we have some very specific targets and performance measures that we are expecting and working hard to achieve on a provincial scale. So if you look at the top line, this one pertains specifically to healthy eating. The 2023 target is to increase the proportion of British Columbians who eat 5 servings of fruit and vegetables a day to 55% from the 2009-2010 level of 44%. So it's a really key policy document because it sets some very specific targets, and at the time it was released, it was a 10-year timeline, and all the work that health authorities are doing should in some way be working towards achieving these 2023 targets on a provincial scale. Another very important document is the toolkit that everyone I'm sure is familiar with. Everyone in this presentation is familiar with, looking at the Healthy Built Environment Linkages Toolkit produced by PHSA with input from members of different disciplines and fields across the province. And specifically, the content in the toolkit related to healthy food systems really points to the role that local governments can play to enhance agricultural capacity, increase access to healthy foods in all neighborhoods, and improve community-scale food infrastructure and services. And again, trying to achieve that vision of environments, built environments that can support access to and availability of healthy foods for all. So we've got some really key statements, mandates, policy papers, and tools, supportive tools that can help us start to have conversations about how we can work collectively in partnership between health and local governments, and bringing those different perspectives together, those different skill sets and toolboxes together, if you will, and start working together on creating environments where people can achieve health and stay healthy for longer, and looking at disease prevention. So with respect to what the work looks like in the ground, we've got some shining examples here in Interior Health, and this particular example is from the City of Kamloops. So the City of Kamloops developed a sustainability plan several years ago, and due to some really active partnerships between the Kamloops Food Policy Council and the social planner and other staff within the City of Kamloops, some really solid relationships had been built, and the Food Policy Council, as well as representatives of health, were invited to make contributions to the Sustainable Kamloops plan when that was in development. And in fact, we have a section in that plan dedicated to food security. And what that does is identify why food security is important, why it has a role and a place in the Kamloops sustainability plan. What would it look like if we were successful at increasing community food security? How will that be measured? And what steps will we need, again, working collectively to achieve that success? So this is one of the examples that we have here in Interior Health that highlight the partnership work between health and the city and how we can work together to achieve success on a community level. So specifically, some of the language from the Sustainable Kamloops plan look at increasing community gardens by 100% by 2012, working with developers to integrate community gardens into new multifamily development, to pursue opportunities to use city landscapes and undeveloped areas for growing food, and increase knowledge around the benefits of locally sourced food. So it was a real statement on behalf of the city about what they wanted to see in community, and setting in the instance of the top bullet, looking at a really measurable increase with a timeline. And the next slide just indicates what was achieved in Kamloops and what was possible in Kamloops. So there was a vacant lot that was owned by a developer in the downtown area, right central in the downtown of Kamloops, and some food security movers and shakers in the community, along with the city, approached the developer to inquire whether or not that land could be used as a public produce garden. And the developer didn't have immediate plans for it, and the developer agreed that yes, in fact, that would be a possibility. So working together with community volunteers, volunteer gardeners, master gardeners, that land was transformed into a public produce garden. And this is what it looked like after all the work had been done by all the different actors in the community to pull it together. So what they did was they developed and constructed garden boxes, and recognizing that the land might only be available for a short time, a couple of years, so that it could be disassembled and reassembled on another site. And then the garden boxes were planted with produce and foods that people could eat. And then there was really clear indication through signage inviting anyone walking by, tourists, locals, to come into the garden and take food, eat food. And in that respect, it was a public produce garden accessible by the public. And they did a lot of education around signage and helping people, citizens, walking through, recognize and identify when something was ready to be picked, when it was right. And it became a real hub for the downtown core, and people from local businesses would come out at their lunchtime and just spend their lunch hour in the garden, maybe eating some of the food, but just maybe spending some time in a peaceful green space in the middle of sort of the urban center of downtown Kamloops. And another important function that this public produce garden served was a demonstration of what is possible in the city to increase people's access to healthy local food. So it served multiple purposes and was a real success for the city and that partnership working together to achieve what had been outlined in the sustainability plan. So on the heels of the sustainability plan, a food and urban agriculture plan was developed, and this was just released in September. And again, specific language related to food security and increasing community food security and the role that different players can function to contribute to those overall goals. So in this one, Area 1 was identified food production and land availability, and the goal is to increase sustainable urban and local food production. And then there are specific strategies that identify more clearly how that goal is going to be reached. So looking at the use of existing land and infrastructure for sustainable food production, looking at zoning and other regulations to support urban and local agriculture, and then ultimately support increased accessibility of local food production. And then in Area 2, food processing and preparing, the goal identified was to increase opportunities for processing and preparation of locally sourced foods, and the strategy to support that is to support commercial and community-based food processing facilities, whether that's like a commercial canning and preservation or some sort of a community kitchen. But in the end, it was a really clear declaration on behalf of the City of Kamloops of what they were willing to put into some of their really fundamental policy documents that underscored their commitment to addressing food security and urban agriculture on a community scale. In addition to the work that we do and our public health dietitians support in their relationships with local governments, looking at food security, we also have a program within Interior Health called the Community Food Action Initiative, wherein we put grant dollars into specific communities so that communities can work to improve or increase their community food security. And this funding has sort of evolved over the years in terms of our criteria. And in the early days, when what food security was not that clearly understood, we used those dollars to really generate discussion and dialogue on a community level about what are the community's barriers to accessing healthy, safe food, and what could be done to overcome some of those barriers, and shifting the identification of the barriers into an action plan to overcome some of those barriers. And over the last 8 to 10 years, the funding has evolved to a stage where communities have really progressed and have really gained some traction with respect to their food security work. And they don't need to just use the funds to come together and talk about food issues. They need a longer-term source of funding to really put action into place and really move things forward on the ground. So now we're in what we call a multi-year funding model. So we grant $15,000, $15,000 per year to 4 communities, and we make that funding commitment for 3 years. And that allows communities to really look at developing a longer-term plan, and they know that they're going to have funding for 3 years to achieve different aspects of that plan. What we've also done with this funding, grant funding initiative, is to really identify the necessity of having local government as partners in the work, and really identifying that we now see that as a best practice from the field. And we need to embed this work in systems that influence a community scale or a regional scale, and systems that will outlive sort of the shorter-term funding, the 3 years of funding that we're able to put into communities for this Community Food Action Initiative. So we require these funded projects to embed best practices from the field in their work. We require funded projects to have a declared and active partnership with local government and a demonstrated investment from local government in order for those projects to be funded and move forward. And again, in terms of best practices from the field, we see that that's what it takes for long-term success. So food security in action, this is an example of a CFAI, Community Food Action Initiative funded project in Williams Lake. And what we have in the top photo is an abandoned gas station in the downtown core of Williams Lake. And it sat there vacant for several years, and it was kind of not that, it was just kind of underutilized, and it just didn't really hold a lot of promise. And what the Food Policy Council did in that community was they approached the local government with the idea of using that space to develop a food cooperative where local farmers could come and sell their food in a market environment. And so what ended up happening is that the city, in terms of their contribution, gave the group a break on the space and taxes, and there were many contributions from local businesses to help renovate the space and make it ready for a storefront that could support, again, local producers and farmers to come together and sell their local produce. So what we have now is Caribou Growers Co-op, and this is the beautiful storefront that's been created. And again, it's a not-for-profit, a cooperative concept, open year-round, and over 50 farmers and producers throughout the Caribou-Chilcotin are able to bring their products here and sell them and get healthy local foods in the hands of people in Williams Lake, instead of people having to travel out to farm gate, and local food from local farmers isn't always available in grocery stores. So it's been open since 2010, and it's growing every year. And also in that same space, there were other storefronts or office spaces created for other opportunities. Community policing occupied one, and having a presence of community policing in downtown Williams Lake went a long way to reduce crime, etc. So it's been a real success story for Williams Lake and a real shining example right in the downtown core as to what can happen when local governments and farmers and food security actors and stakeholders in the community work together to identify a common goal and work together to achieve that common goal. Another example of food security in action is looking at backyard hens and how to support individuals and homeowners to have chickens in the city so that they can have access to fresh local eggs. And some other examples include things like, this is from the city of Kelowna, looking at the invitation for IH to have membership at the Agricultural Advisory Committee, and again, bring that health perspective to discussions related to agriculture, land use planning, and the Agricultural Advisory Committee then advises Council on decisions Council needs to make related to, again, land use and agricultural production within the city. And when the AAC, the Agricultural Advisory Committee, makes comments to local governments, it really brings the perspective, it brings the health perspective, having health membership, and then also people with expertise in various aspects of agriculture, economics, etc., and can advise local government when considering rezoning agricultural land for other uses, as well as requests for exclusions from the agricultural land reserve. And in Kelowna, we are under pressure for development and excluding agricultural land from the agricultural land reserve to meet development pressures. And from a health perspective, we're really working to help local governments understand the importance of preserving agricultural land for agricultural purposes in the interest of food security. And another topic that I wanted to just mention is that it's important to also consider what we call the unusual suspects. So partnering with people who you typically might not consider partnering with, but can advance the agenda on a community scale beyond what you even thought possible. So in Cranbrook, we again look to the Kamloops example of a public produce garden. And in the early days of 2011, our public health dietitian took the concept of a public produce garden to the Cranbrook Food Action Committee, and a representative from the city of Cranbrook was there. And there was interest among the city of Cranbrook about this idea and what it would look like in their community. So the city, together with the Cranbrook Food Action Committee, made a joint application to the UBCM Age-Friendly funding. and really brought the perspective of the benefits of a public produce garden to people of advanced age who might be struggling on various levels to remain healthy, to access healthy foods, etc. The following spring in 2012, there was a kickoff event for the public produce garden, followed by, again, working bees and getting people out from the community to get the garden ready. And what we saw over time is that what we see on this map in the square, this is a previously unused park, kind of a forgotten little space in the city of Cranbrook. And after the development of the public produce garden, we saw a complete revitalization of this neighborhood and a gathering place for people to come in this public produce garden, to come and do gardening, to come and connect on a social level with other people who have a common interest in gardening, as well as making produce available for people who wanted to eat it and take it home. As a result of that sort of revitalization on a social level and it developing sort of a hub atmosphere, the city made the decision to upgrade the basketball court and rebuilt the play structure and playground because there were so many people now coming back to this park. So the city really saw the benefit in capitalizing on the interest that had been generated through the public produce garden and then made other improvements to the space. And again, it's become a real gathering place for this community. And of course, we had lots of community partners involved in this work as well. And there's tons of activities still ongoing, gardening workshops that are supported by the Columbia Basin Alliance for Literacy, and funding was also secured from New Horizons for seniors. So the point of this slide is to just highlight that sometimes we need to think about asking people to get involved that we typically might not associate with this kind of work, and appealing to different granting agencies like the UBCM age-friendly funding that, again, might not be the first thing we think of when we think of a granting agency, but they may in fact have an interest in this work. So the take-home message from this whole presentation is that we have many opportunities to create and strengthen healthy food systems. We need to have conversations and identify where it fits with current and future priorities, both on a provincial scale, as well as a local and regional government scale, as well as a health authority scale. We need to take a long-term approach, but in that long-term approach, look at using small grants to fund littler projects that can advance the overall work. So to get some early successes, to bolster people's enthusiasm and energy to go for the long-term work where we're going to see long-term change in community. I think it's also really important to reach out. There are many others who are interested in working together, and sometimes they just need to be invited to get involved. And it's also really important to celebrate small successes. It's so easy to think about how much work there is still to do or how much mountain there is still to climb without stopping to look back on what's been achieved to date. And that's particularly important when we are engaging community volunteers and other partners, that there has to be some element of celebration and fun in the work that we do. And I think it's safe to say that that's pretty easy when it involves food, because food is often associated with social events. So that's the conclusion of my presentation. I would just like to say thank you again for inviting me to share my message. My contact information is at the bottom of the slide, and I'd be happy to respond to any questions that you have by email, or feel free to call me at any time. Thank you.